Good afternoon, everyone. We're going to give everyone just a couple minutes to come in. Thank you so much for joining right on time. We'll get started in just a couple minutes. Great. I think we can get started. It's so wonderful to have everyone joining us today, I think for one of our very last Regional Champions webinars for the year. As far as introduction, my name is Kim Beer. I'm the Senior Director of Public Policy and Advocacy at the Christopher and Dana Reeve Foundation, and it's my privilege to join you and all of my colleagues to give you some important updates. Just wanted to pull up my remarks here. Okay. I want to really emphasize that your continued engagement and commitment are essential to advancing our advocacy priorities and improving the lives of individuals living with and impacted by paralysis and their families and caregivers. We've had a very successful year, and I'm excited to hear more from our panelists and my colleagues about the election results. And before we dive into that, I'd like to share a few brief thoughts. As with any new administration, the shifts in priorities and policies present opportunities to address the ongoing challenges facing the disability community. At the Reeve Foundation, our focus remains steadfast, ensuring the perspectives of the paralysis community are represented and that disability-related issues are prioritized in policy discussions. Looking ahead, we will approach the new year as we always do, with a commitment to collaboration and bipartisan engagement. This past year has brought meaningful progress. We protected PRC funding, advanced efforts to improve air travel for people with disabilities, and continue to grow our vibrant grassroots community. You'll also hear from my colleague Angel. She'll discuss the needs assessment survey, which hopefully landed in your email inbox today, and how the importance of your feedback will be critical as we develop our top priorities for the coming year. These priorities, of course, will also include strengthening our partnerships and building relationships with both new and returning policymakers. Your ongoing involvement is critical, from sharing your stories to working directly with Gerard and your fellow regional champions, and developing relationships with your representatives and senators. I want to thank you again for your dedication to the foundation and our shared advocacy goals. As a reminder, this session will be recorded. I will be monitoring the Q&A for questions, and please don't ever hesitate to reach out to any one of us for support or answer any of your questions. Next slide, please. So for today, we have a full agenda. We'll talk about the election and the congressional updates. We'll talk about some of our congressional priorities and some updates there, especially as it relates to appropriations. We'll hear from Angel about our coalition updates. We're very active, and as you know, in many different coalitions that are working on ancillary and very important critical disability-related issues. And then we will hear from Gerard. Gerard has had a remarkable year growing our grassroots efforts, and we know how active and engaged you all are. So we're so grateful for that. And then, of course, we'll have time for Q&A. So I think now I'm passing it over to Celicia.
Perfect. Thanks so much, Kim. And as Kim mentioned before, good afternoon, everyone. My name is Celicia Lomax. I'm a director of health policy at Waxman Strategies, which is a mission-driven consulting firm based in DC that's been working with the Reeve Foundation for several years now. And I'll share a little bit on the 2024 election, going briefly through some of the results and some of the next steps that will be coming with that, and then passing over to my colleague. So we can go on to the next slide. So, as many folks know here, the 2024 election did happen a couple of weeks ago. And with that, with the presidential results, Donald Trump and JD Vance did have a decisive win in the 2024 presidential election over Kamala Harris and Tim Walz. What many folks were paying very close attention to were the 7 swing states within those results. And as you can see in the image on the left, all 7 of those swing states were won by Donald Trump. And so now we're looking at what the sort of next steps are, what will be happening as the Trump administration begins next year. And that big portion of that is focused on this transition right now. So that transition is actually kicking off. My colleague John will be talking a little bit later about some of the nominations that are being made for different leadership positions. And at this stage, there's a combination of reassessing policies and priorities that are happening within the current Biden administration as they round out the last few months of this administration, focusing on the things that they'd like to get done before their term is ending, and also for new leadership that will be coming in for different agencies as they think about their priority areas. Many of the things that we heard as far as some of the priority areas for Donald Trump and his team has focused on things like immigration, on tax cuts, on tariffs. And so these are the types of areas that we are continuing to see in news cycles and thinking about. So in connection to that, there are key personnel appointments that really drive administration policy. And so we'll be talking more about different folks that fall into those categories for different appointments, including White House staff, thinking about HHS secretary, other agency heads in that regard too. And we'll get a little bit more into that. What does this mean for the Christopher and Dana Reeve Foundation writ large? As Kim mentioned at the very beginning of this call, the Reeve Foundation is going to continue to do the work that it's always been doing. We really are focusing on advocacy and support, the funding of the Paralysis Resource Center, which so many of the folks on this meeting have been very engaged with, and that work will continue, continuing to focus on research on spinal cord injuries, as well as caregiving resources. And this would be the case under any administration, under any congressional makeup. The Reeve Foundation continues to do that work to support the people within this community. So we can go on to the next slide. And so in addition to, of course, the presidential results, there were election results on the congressional side. And within this slide here, there are images for each of those results. The Republicans were able to reclaim the Senate with a 53-47 majority. They were able to gain a couple of seats that have flipped from Democrat to Republican now. And within the House, Republicans were able to retain their control of the House. The numbers are actually still coming in. Surprisingly enough, it's been a couple of weeks, but there are still votes that are being counted for the last few seats. But given where the results are now, Republicans will be retaining control of the House and the Senate, which means that across the board here, there will be Republicans leading the executive branch, as well as both chambers of Congress with the Senate and the House now. Although it's important to note that these are very slim majorities that they will be working with. And so looking at both the House and the Senate, when it comes to significant legislation that they would like to pass, when it even comes to confirming the nomination of different appointments, it will be important for there to be coordination across the board in which the various members of either chamber will have to work together to think about what legislation they would like to pass, how to negotiate those different types of bills and policies, and how they might be able to work with the Trump administration as well going forward. So we can go on to the next slide. And of course, we're happy to answer any questions. And I'll just say before passing to my colleague that, of course, a big portion of this transition kickoff, as I mentioned, is that Donald Trump has started to name nominations for various appointments. So I will pass over to my colleague, John, to talk more about those, to talk a little bit about confirmation process or not for different folks here, and take it from there.
Sure. Thank you so much, Celicia. And before I dive in, I see Mary Beth in the chat has her hand raised, and I'm not sure if that's as a question or if Mary Beth, you are the ASL interpreter asking to be promoted to a panelist, so we can include that. But just want to give Mary Beth a moment in case she has a question. And Kelly, I'm not sure if I need to do anything to acknowledge that either. Okay, I'm gonna keep going, but please interrupt me if we can get Mary Beth and her question on the table. So thanks to the Reeve Foundation, thanks to everyone for being here, and thanks Celicia for turning it over. A huge part of any transition of administration is the naming and appointment of new personnel. There are within the federal government about 3,500 jobs that officially change every time there is a new presidential administration. The most prominent of those, of course, are the cabinet positions, who are by and large heads of the different federal agencies, but there are a whole lot of other jobs, both heads of other agencies, political appointees who help drive the work in each of those agencies. And so personnel and changes in personnel are a huge part of any transition. Just to name a handful of the folks, if folks have been following the news, they will certainly have been following this, who have been named thus far. Obviously, Senator Vance of Ohio has been elected vice president alongside incoming President Trump. Senator Marco Rubio of Florida has been named as the nominee for Secretary of State. Pete Hegseth, who is a combat veteran and prominent Fox News host, has been nominated and named as the potential nominee for Secretary of Defense. Kristi Noem, the governor of South Dakota, has been named as the nominee for the Department of Homeland Security. Just in the last hour, Congressman Matt Gaetz, who was put forward as the nominee for Attorney General, has actually withdrawn his nomination. So we're going to see who they go with next there. Susie Wiles, who ran the Trump campaign as campaign manager, has been named as the incoming White House Chief of Staff. These are all positions we follow and pay attention to, but the two next positions that have been named and several of the other positions that haven't yet been named are ones that we pay very, very close attention to, including because of their impact on the disability community, on the Paralysis Resource Center, and on some of the health-related programs that oversee folks as they are working in health policy. So at the full Department of Health and Human Services level, the nominee is Robert F. Kennedy Jr., who was also a presidential candidate, independent presidential candidate, who earlier in the race dropped out and endorsed President Trump. Dr. Mehmet Oz, who is a public figure, first, I think, made famous through Oprah and other on television appearances, who also ran for Senate in Pennsylvania, has been named as the nominee for the head of the Center for Medicare and Medicaid Services, or CMS. CMS, as well as the National Institutes of Health and ACL, the Administration for Community Living, are all part of the Department of Health and Human Services, along with other agencies, HRSA, SAMHSA, CDC, FDA. And so Dr. Oz will technically report up to Secretary Kennedy if they are both confirmed. Still not announced are the Trump nominees for the National Institutes of Health, which oversees almost $50 billion budget and supports so much of the biomedical research that happens in the country. And of particular focus for all of us, the Administration for Community Living, which oversees a wide range of programs supporting both aging and disabilities. And so we will be focused on tracking these personnel changes, not only at this cabinet level where those folks will require Senate confirmation, but also at the lower end staff levels, including some positions that don't require Senate confirmation. Those will be in addition to the career agency staff who work in each of these agencies, folks who we'll work with together over the next 4 years to continue advancing the priorities that Kim and Celicia talked about. So we can go to the next slide. So let's switch gears for a moment and talk about Congress. Congress, as Celicia said, will be seeing some changes in the next term. But before that happens, they actually have some unfinished business that they are now coming back to town to finish up post-election in what's known as a lame duck session of Congress. And so they've returned to town. They are planning to work until the end of the year. And there are a handful of things that are very much on their to-do list. First and foremost on that to-do list is figuring out their plan for what will happen with government funding, or appropriations, as we call it here in DC, for the rest of the fiscal year. As a reminder, the current fiscal year 2025, began in October, but Congress, as is often the case, has not finalized the budget for the current fiscal year and set spending levels for each of the programs. So they have several options of what they can do to finalize or to move ahead that funding process. The first option is they can come to a deal before the end of the year. The current short-term funding extension expires on December 20th. If they choose to, they can come to a deal and fund the government for the rest of the year based on that deal through next October, or through next September, excuse me. If they choose not to do that, they can also pass another short-term extension. And this is a little bit of the way it's looking. It seems like these decisions have not been finalized yet, but it's possible that they will pass another short-term extension until the spring. That presents its own set of complications because they will still be having to finish this year's budget, even as they work to start the process of taking up next year's budget. But it would not be the first time that that has happened. Or they could pass an extension, what's known as a continuing resolution, that goes through the entire rest of the fiscal year. This is known as a year-long CR. That's probably the least likely option at this stage, but it is always an option for Congress. So I think, just to put in context, those funding decisions affect thousands and thousands of government programs, including programs across HHS, within ACL, and the one that we pay the most close attention to, the Paralysis Resource Center, which is funded by ACL under an appropriation from Congress and is operated by the Reeve Foundation. The good news is both the House and the Senate have proposed full funding for the Paralysis Resource Center at the same full funding level of $10.7 million for this fiscal year. That has not been finalized and passed into law, and we'll need to wait until the overall funding bills are finalized before that happens. But this is about as good a position as you can be in as we head into that next period of uncertainty. So just to give a little context for the rest of the timeline. So as we mentioned, and Celicia alluded to, Congress is back in town now. They are going through the process of holding elections and organizing their own selves. So one election of note is that Senator Mitch McConnell, who is still in the Senate, has decided to end his time as Republican leader in the Senate. And he has been, through election of his conference, replaced now by Senator John Thune of South Dakota. So he will be the majority leader in the new Senate. Most of the other congressional leadership is staying the same into the next Congress, and that will be finalized once the new Congress takes its seats in January. They're also working on trying to finalize any outstanding business, reintroduce bills, or get them queued up for reintroduction next year, finalize the negotiations on appropriations, as we said. By December, they will have to make a decision, as we laid out, on short-term or long-term funding. And then January 3rd, the new Congress takes office. And so new members are already, newly elected members are already coming to town, doing orientation, starting to, bit of inside color, they work out of the cafeteria. Each new office gets a couple of tables in the cafeteria. And then once the exiting members are out, there's a whole shuffle for office space. So that takes a little bit of time. If you're coming and meeting with your member in DC early in the new Congress, don't be surprised if you're meeting in the hallway or you're meeting in the cafeteria. But that will all shake out in time. The new Congress will take its seats, and then in the spring, will really start to turn their attention to next year's budget and to other legislative agenda items. But primarily, that budget process starts up again in the spring. So just echoing the thanks to all of you. We know that this process can be a little mind-numbing and a little maddening, but I was able to join many of you in the Advocacy Day last month, or maybe 2 months ago now, and it was just phenomenal to get the community starting to weigh in directly and making your voice heard in support of the PRC and the other priorities we talked about. So we can go to the next slide. And here, I think I'm going to turn it quickly to Angel to talk about a development on the Department of Transportation side of things.
Thank you, John. Hi, everyone. I'm Angel Hines, the Public Policy Manager here at the Reeve Foundation. And I'm very thrilled to tell you this announcement that this past October, the Department of Transportation issued a $50 million penalty against American Airlines due to its treatment of passengers with disability. This is a landmark penalty that was issued. It's larger than any previous DOT penalty issued for airline violating disability regulations. So I just wanted to make sure that everyone here was aware of that, and thank you for your continued advocacy around accessible, safe, and accessible air travel. This 50 million penalty, 25 million was to be paid up immediately after the order, and the other 25 million of this penalty is to go towards making the airline more accessible. So that accessible, it mentioned things like installing lifts at various airports, and they have to prove that this money is going towards making sure that people can board and deboard the plane in a safe and dignified way. There's still a lot of work to do. This is just the beginning, so we just want to remind everyone how important it is to file those complaints, not only with the airline, but also with the Department of Transportation, so that we can see things like this happen. So, and our follow-up email will make sure to include information, again, as a reminder, how you can, if you have any issues while you're traveling, where you can report a complaint if you need to. Next slide. And the slide after this. So I'm going to talk a little bit more about some other coalition updates. I'll give some additional air travel updates, and then caregiving, talk about our needs assessment survey, And then there'll also be an update later on from Gerard regarding advocacy around a letter to CMS regarding power standing chairs. Next slide. So for accessible air travel, I wanted to share with everyone this past September, the Reeve Foundation sponsored the Global All Wheels Up Accessible Air Travel Conference. It was held at the Volpe Center, the Department of Transportation's new center in Boston. It was a wonderful conference, and it was attended by researchers, airline designers, and engineers, and advocates, disability advocates like us at Reeve, that come together each year to talk about the goal of being able to stay in your mobility device on an airplane. This year was really exciting because Airbus, Collins, Boeing, they all presented different mock-ups or research that they're doing internally, working towards this. And I left feeling really hopeful. I just shared a photo here on the slide. This was a part of the Airbus perspective. And excuse me, and they had what they were calling a multi-purpose compartment. And this mock-up shows a power wheelchair that's latched in, but it also had area for a caregiver. It had could be configured to also have a service animal if you travel with a service animal. So I thought this was a really cool one that I wanted to share with you guys. And as we find out more about this, I will definitely keep you informed, but people are definitely working daily towards this goal. Next, I just wanted to share that if you can go back, I wanted to just say a couple more things about the proposed rule on safe and dignified air travel. That was a comment that we asked everyone to submit comments on, and we submitted comments on. We still have not heard about the final rule, but all of our coalitions that are working on this, we just sent a letter to the Biden-Harris administration urging them to please release the final rule, hopefully before the end of the year. So I just wanted to make sure everyone had an update on that. And we also signed on to comments on family seating in air transportation. The Department of Transportation has proposed a rule to develop policies around families not being separated when they travel on a plane together. And we just want to make sure that the airlines, when considering these policies, also consider people with disabilities and when they are drafting these policies. So that's the latest in accessible air travel updates. And if anything else comes up, I will pass it on to Gerard to include in the update. Okay, now next slide. So recent caregiver policy programs, there's been a lot going on in this space. Various members of our team attended a few conferences. There was the 2024 National Caregiving Conference held earlier this month. And I was fortunate enough to sit on a panel where we talked about navigating policy areas on disability and aging, and included speakers from CMS, a representative from New Jersey Congressman Chris Smith's office, and the National Alliance on Caregiving. And one of the main points that kept coming up is how important it is for you to share your story with the policymakers, with the members of Congress. So we have to just keep continuing to do that work. Also, we attended a congressional briefing on caregivers that was held earlier this week, actually, that was coordinated by the Rosalind Carter Institute. And yesterday there was the Caregiver Nation Summit held in DC. So there's a lot happening there. And we signed on to a coalition letter supporting the passage of the Credit for Caring Act. This act's led by Senators Michael Bennet and Shelley Moore Capito and Reps Mike Carey and Linda Sanchez. And it's to help offset caregiving expenses like adult daycare services, home modifications. And we just wanted to sign on to this letter to push for this to hopefully get passed. Next slide. Oh, Needs Assessment Policy Survey. Very excited about this. So all the things that we're talking about today, all the coalitions I sit on, we really need to hear it from you. So we sent out, you'll find in your email inbox today, the survey that we send out every 2 years, and just add, so we can get the pulse of the community on what policy issues are important to you. Here you'll see our 2022 survey results showed housing and assistive technology and research and peer and family support. So these are the things that we are asking for you to let us know what you are most interested in hearing and it informs us as we head into 2025. So after the call today, you probably will see this email. We hope that you will take just a few moments to give us feedback and let us know what you are interested in, what's top of mind to you. Okay. Next slide. I think I'm going to move on to grassroots. And I just want to say one more thing. When Gerard does talk about the standing letter and action alert that we had advocates work on, I just want to thank you for that too. And we are still waiting to hear if that is going to be opened up by CMS. So I don't have much of an update there, but Gerard will go more into it. Okay, Gerard?
Thank you, Angel. Before Gerard goes, I just wanted to bring up some questions we're receiving. I'm hoping John and Lisa can help me here. We've been getting several questions about the potential impact of Project 2025 on the disability community and some of the policies that may or may not be implemented or addressed in the new administration.
Sure, I'm happy to start, and thanks, Kim, and thanks to folks who asked those in the chat and leading up to the webinar. So just to give context for those who haven't been following us closely, Project 2025 is an independent effort led by several different conservative leaning groups to map out a policy agenda that an incoming Trump administration could take action on once it takes office. And so during the campaign, this became a little bit of a hot potato with Democratic side saying, look at Project 2025, it has these levels of proposals, it has these things, and the Trump campaign saying, we don't have anything to do with Project 2025, it's not an official part of our campaign. And so now, and just to give it some context about what it actually is, there's a 900 or slightly longer than 900-page document issued by, this was led by the Heritage Foundation, but with support from some other groups, that goes agency by agency and proposes specific policy changes, specific funding changes, and then across the federal government provides and proposes changes that a new administration could pursue. I think rather than try and get into the specifics of that 900-page document here, I will say a couple of things about it. Number one, it is a separate effort, but we are now seeing some of those policy proposals being embraced by the incoming Trump administration, as well as by Republican leadership in Congress. One of the authors of Project 2025, it's written by a number of different authors in different policy subject areas. One of the authors of the provisions that would look across government was appointed this week to be the head of the White House Office of Management and Budget, which is the federal government sort of chief operating officer in some ways, the budget officer at the White House. And so that person and that agency has a lot of power to oversee policy direction. We're seeing other folks who were involved in that effort likely to be appointed to administration general. So while it was not part of the Trump campaign, we are seeing some overlap between who worked on that effort and who is likely to have a role. I think a couple of things of note in the document overall, probably of most note is that they propose pretty significant changes to the Medicaid program. Without getting into all of the specifics, Medicaid is a large and pretty comprehensive program that's important to many in the community. And the changes that are being proposed are structural in nature. They're changes to the way Medicaid is financed. At a federal level, the difference and the split in responsibility for that financing and for program oversight between states and the federal government. There are also potential changes being proposed around adding work requirements to Medicaid. In general, those requirements, as they've been proposed in different states, have contained exemptions for the disability community, but that is a change that is likely and possibly going to be debated in the coming year. Medicaid is probably the one issue that we know is going to be debated in Congress this year. A lot of the changes that are proposed would require congressional action to take place. And Medicaid will be debated in the context of a larger budget debate that will happen this year because many of the tax cuts that expired under that were passed under the first Trump administration expire this year. And so in order to finance extension of those tax cuts and a new bill that would extend them, which costs money to extend tax cuts, they will have to look for funding reductions in other places. And one of the places that they will look is Medicaid. The other big places in the federal government where you can potentially find savings are Medicare, Social Security, defense, and each of those was in some way taken off the table by the Trump campaign when he was running. So it leaves Medicaid as a pretty big target. One of the things we'll be doing over the course of the coming year is following and monitoring all of these different policy proposals, whether they were included in Project 2025 or not. And one of the things that will be happening is that things that were written as one or two bullets in a large document will start to take shape as legislative language, as regulatory proposals, as much more detailed proposals coming forward. And so that's what we want you to count on us for, to monitor that, to assess and analyze the impact of those changes, and to where it makes sense to weigh in on what that impact would be on the community that we all serve. So happy to pause there. Celicia, if you have anything you would add to that, please jump in, and happy to take any other questions once we get through the rest of the presentation.
Yeah, and for the sake of time, I think we can pass back over to Gerard and happy, as John mentioned, to answer any additional questions that folks have.
Well, thank you, Celicia. Thank you, John, and thank you to Kim and Angel for all those updates. Hello, everyone. My name is Gerard Arnhem. I am the Grassroots Advocacy Manager with the Reeve Foundation. And this portion, we're just going to go over a couple of updates from our grassroots fronts we've been doing over the last couple of months. So first up, as many of you on this call, you may have already participated in this event, but I'm going to be talking about the 2024 Virtual Congressional Advocacy Day we held on September 25th of this year. It was our second annual Virtual Congressional Advocacy Day, where many of our advocates made their voices heard in the virtual halls of Congress. And we nearly had 70 hashtag Voices for Reeve advocates from 25 states and the District of Columbia share their stories with their own legislators and advocated for policies that impact the paralysis community. On the right side of the slide, I listed our three asks that we asked our advocates to talk about in their meetings, and one of them being maintain funding for the Paralysis Resource Center at $10.7 million for fiscal year 2025. The next was maintain the National Institute on Disability Independent Living and Rehabilitation Research, or NIDLR funding, at $119 million for FY 2025. And lastly, it was to ask a simple ask to ask their members of Congress, senators, and House members to co-sponsor the Alleviating Barriers for Caregivers Act, also known as the ABC Act, which is HR 8018 and S 3109. But overall, my team and I, we were just thrilled to see we had a nearly 60% increase of attendees from last year. And it also led to an increase of 41% of the meetings confirmed. And I listed those stats on the left side of the slide. Again, just thank you so much to everyone who signed up, who came to all of our practice training sessions and joined us on September 25th, because we educated a lot of member offices, but we also just made sure that our voices were heard in Congress, and that, you know, we're really looking forward to next year for 2025 when we do another virtual Congressional Advocacy Day. I also just want to quickly thank Lifeword for being a sponsor for the Advocacy Day and making the day such a success. So next up, this is what Angel was talking about. We actually had a recent action alert at the beginning of October. It did have a deadline. I believe it was that first Friday of October, which was the 4th of October. But basically, we put out an action alert. It asked our advocates to reach out to your House member and urge them to sign on to the Dear Colleague congressional letter that was penned by Representative Dingell and Fitzpatrick that's going to CMS. The letter basically asks CMS to open a public comment period for pending national coverage analysis for standing systems and power wheelchairs. And as we all know, last year, Medicare coverage for power seat elevation systems was announced to the Medicare population. So this congressional Dear Colleague letter was to proceed in opening national coverage analysis for power standing systems. But in response, we had an overwhelmingly great response to our action alert. We had 443 advocates send emails to Capitol Hill, which led to 22 members signing on. So again, your voice matters. This is what advocacy is all about. You sent out our action alert, you edited, customized the text, and basically you were able to share your story and how this would impact your life. So thank you all for taking action on our action alert, and there will be more coming in 2025, so stay tuned. This slide just shows a list of signers of the Dear Colleague letter. I sent this list out actually in one of my regional champion newsletters a couple weeks ago, and a few of our regional champions reached out to me and asked if they can send a thank you note. So I really appreciate all the regional champions that took the initiative, wanted to say thank you to their member for signing on. And, you know, I was able to provide them with the information, the contact information of their congressional office so that they can pen their own letter and say a thank you. So thank you to all for reaching out and for wanting to do this. We really appreciate it. So next up, I want to quickly talk about is a regional advocacy training that we held in Woodbridge, New Jersey. It was with Angel and some of our colleagues from the New Jersey office. It was actually our 4th regional advocacy training at LeGrand Coffee House. But this regional advocacy training was formatted a little bit differently than previous ones. Obviously, the event was open for anyone to join, take PRC resources, and learn about our grassroots advocacy programs and more about the Reeve Foundation. However, after we talked about, Angel and I talked about this, we kind of segued into a advocacy-styled conversation where we focused the conversation talking with Eric LeGrand and some local regional champions, Darren and Sam, who are from New Jersey. But like I said, the conversation focused on each individual's personal advocacy journey, their motivations, some key advocacy initiatives they completed throughout their advocacy days, and how to raise more awareness and looking to the future. But the key takeaways from this event and from this conversation really were empowerment, meaning that every individual has the power to advocate and create change, whether it's through grassroots efforts or larger advocacy initiatives. As always, community engagement, advocacy is stronger when we work together. Leveraging community resources, talking about the Reeve Foundation, talking about the PRC is key to our success. And then we also gave actionable steps, encouragement to stay connected with us, stay connected with the Reeve Foundation, stay connected with me, join the Regional Champions Program. become active in your local and national advocacy efforts with any type of organization. But you can stay active with the Reeve Foundation. But I just want to thank Darren and Sam for participating in this event and making the journey out to LeGrand Coffee House, Angel and the Reeve staff for being there and help supporting this event. But also a huge thanks to Eric LeGrand and the staff at LeGrand Coffee House, has amazing coffee, by the way, for accommodating us and letting us host this event at this business. But also to PSCG New Jersey, who helped support this event and make it a possibility. There will be more going into 2025, and I'm very excited for next year. So stay tuned for that. I'll be working to see what location I can go to next. But it was just a fun day, and these are just some pictures that I had from after the event. So if you're watching and you were there, thank you. It was such a great event to be a part of. But yeah, so we'll go to the next slide. So I wanted to kind of highlight our Team Reeve marathoners in Chicago and New York City. And we all know the past few months have been busy, but this past October was the Chicago Marathon, where Reeve Foundation colleagues went to cheer on runners and hand cyclists for Team Reeve. Throughout this whole past year, runners, hand cyclists, both on Chicago and New York City, they trained and they also raised funds that go directly towards spinal cord injury research. But this year was huge because Chicago and New York City teams raised over a combined total of $990,000, which is well past our goal. And I just want to say congratulations to both the Team Reavers from Chicago and from New York City for taking on the 26.2 miles, because it definitely is not easy and it's very difficult. And they trained, they worked hard, and they conquered it. So that's also amazing. But these are some pictures that I grabbed from Chicago. And the next slide is going to show some pictures from New York City. This was the first Sunday of November, so that was November 3rd. And in total, Chicago had 45 athletes and New York City had 90 athletes. So we're growing every single year for people who want to run, hand cycle for Team Reeve. But if you are not interested in running and that's not your style, that is okay, because you can also participate in our Team Reeve All-Stars program, which is something from the Reeve Foundation. And I did make a note to send a link in the follow-up email, but there is no fundraising minimum and you can do any type of event you want. It doesn't have to be running or hand cycling. However, if you do want to do like a small run, or you could do a 5K, 10K, or a half marathon, or you could just host a dinner or a bake sale. There is no limitation. And if you are interested in like joining this Team Reeve All-Stars program, you can always reach out to me after I send the follow-up email. So last but not least, looking ahead to 2025, and then we're going to get to some questions. We're on time. Please don't forget to fill out the 2024 needs assessment survey. Angel was speaking about this earlier, and your input matters. It helps our team shape our public policy priorities for next year. So I believe I received the email for filling out the survey at around 11 a.m. this morning Eastern time. So please check your inboxes. It's definitely there. And it takes less than 5 minutes to complete. So it really helps, and we really want to hear what your input is. Next up, we have, since the virtual Congressional Advocacy Day, we've welcomed so many brand new regional champions to the program, and I am just elated, so thankful for that people want to join this program. So in the next few weeks, I'm going to be sending out a Zoom link in my Regional Champions newsletter, and it's going to be for our next Regional Champions coffee session, which is where regional champions can come, meet one another, learn more about the program, learn what they're up to in their local advocacy efforts. But this will be on January 10th, which is a Wednesday, from 3 to 4 p.m. Eastern time. So please save the date for that. And lastly, please tune in next year for our next virtual Congressional Advocacy Day. All are welcome to participate. And I just want to say thank you to everyone for your dedicated advocacy work in this past year, 2024. This year, like Kim was saying, we continue to grow our grassroots advocacy programs, our advocacy community, and going into 2025, we really need to keep this momentum up. Going into this new administration, this new Congress, it's just extremely important that you develop relationships with your members of Congress, your House members or your senators. It's very important, and we can help you do that. We can help you educate them on issues that impact the paralysis community. And you can just really do this by sharing your own personal story, your own personal experiences while living with paralysis. So If you are interested in joining the Regional Champions Program, please reach out to me for more information. We can set up a time to talk, get to know you more, your advocacy experience. You don't need any advocacy experience to be a regional champion, but I just want to get to know you more. So please reach out to me. But once again, just thank you all for your dedicated advocacy work in 2024. There's going to be much to come in 2025, and I'm very excited for it. So I think we do have time for questions, so I'm going to give it back to Kim. So thank you all.
Thank you so much, Gerard, and to all our panelists. Let me see if we have any questions. It doesn't look like we do. I really just want to encourage everyone to stay connected to us. We'll do our best in the new year to be consistent with our communications. And please, again, Gerard will speak to you at any time. Any one of us will too. So it looks like we have a question from Kat. I don't know if you're able to put that in the chat. Let's check. Kat, I'm not sure if I don't see your question, if you're able to put it in the chat. Otherwise, we can follow up with you after. I'm sorry about that.
Kim, it's saying some anonymous person said the chat is disabled.
Oh no. Kelly, would you be able to help us see if we're able to get individuals? Wonderful. So sorry about that. Thank you for letting us know. We'll definitely stay on to make sure we get everyone's questions. Thank you for flagging that for us. I think we're about to, excuse me, enable the chat. The chat is enabled. So sorry about that. If there are any questions, we'll give everyone a few minutes just to type it in the chat box.
So Kat wanted to say that she heard from her representative about progress with transportation in Miami.
Oh, good. Fantastic.
That's amazing, Kat. That really is, that's great. Thank you for telling us.
Kat is an incredible regional champion from Florida. We thank you for all your efforts. I really encourage everyone to attend Gerard's coffees because virtual coffees, because people get to meet each other, share their stories, but also all the activities they're involved in their own states and districts. Let's see, we have. Okay, so someone asked about the tariffs, proposed tariffs. Now, I wouldn't say this is exactly my specialty, expertise, but it's something certainly we'll definitely be tracking. And so, John, I don't know if you have anything to add here. How will proposed tariffs affect everyone's supplies? It's a very good question.
Sure. I will also say no expert in tariff and tax policy here, but as a general matter, President Trump during the campaign proposed significantly increasing tariffs, essentially the charge, the tax on imported goods from countries around the world. And I think we will see, as with many of the things, I think a lot of more specifics about that once they take office. This is one area where the president has a lot of authority and the administration has a lot of authority on its own to make changes. And so if they were to go ahead with the level of tariffs that they've proposed, which is, I don't have the details in front of me, but significant tariffs on imports from all around the world and in particular on China, the expectation has been that will make goods more expensive. It's because companies and others who have to pay those tariffs are expected to pass the cost of that through to consumers. As a general rule, this will be different in different industries. It'll be different in different circumstances. But it's a great question and probably one we should keep an eye on, just for its overall impact on the cost of living, but in particular on the cost of medical supplies.
Thank you, John. Felicia, I don't know, did you have something you wanted to add?
No,
And if you don't, that's fine too.
Yeah, I guess the only other piece regarding the tariffs piece, which 100% agree with John. I think there's more that we will be seeing in the future there as well. But there have also been conversations amongst economists and others around the impact on domestic supplies, and a hope that it could potentially incentivize more supplies that are sort of manufactured within the United States as an opportunity for folks to have access to them. But as John mentioned too, there are definitely concerns about the increase in costs for goods and supplies as people receive them from other places.
Thank you. We have another question from an attendee about the LaTanya Reeves Freedom Act. And I'm glad that you're informed about that act. We have supported this, I believe, through our coalitions. Angel, I want to give you an opportunity to weigh in. But this bill would allow people, I think, some flexibility about where they go for some treatment and rehab. And I'm pretty sure we are a supporter of this.
And yeah, I'm happy to double check and see the status of that. And in our coalition meetings coming up next year in January, I'll double check and see where, you know, how people are feeling around the bill and if there's any movement. I don't think there's been anything that's happened on it lately, but as we enter into the new term, a lot of these bills get reintroduced, and so I will definitely take a look at that.
So Lisa, did you want to add anything to that?
No, I
Okay,
think.
sorry, it comes up on the chat that you want to answer, so I want to make sure I give you an opportunity.
No, I was just showing that they were answered for folks to see too. But no, that was good.
We have a question about what measures a nonprofit can take to ensure that its advocacy, the paralysis community, remains effective despite changes in administration. That's a great question, and I would just emphasize that those who are interested in advocacy stay connected to organizations like ours to be informed about the issues, and we will do our best to keep you educated of what's happening and also opportunities to weigh in. It doesn't really change our strategy that we've done in the past, but I will be committed to ensuring that people get the information as soon as they can. I don't know if anyone has any other additions to that. Great. I think we're up just about time. If there's an additional questions, we can follow up offline with you. So I want to say, sorry, we just see one more chat.
I think
it looks like
question was just about what the bill was about, the LaTanya Reeves Freedom Act.
Yeah, I believe it was around flexibility in where individuals can utilize Medicaid dollars, I think, for nursing homes, but we'll definitely double check. So thank you, Sherry, for that. We'll put it in the follow-up information of the webinar. So I want to thank the advocate who raised that to us. Oh, another great question. And the individual asked about advocacy and policy strategy locally in the states. So we're not an organization that is usually focused at the state level. We focus really at the federal level. However, we encourage you to become connected to Gerard, because Gerard works with advocates one-on-one, and many of our advocates are working on the local level. So we're happy to hear and help you find activities and opportunities at the state and federal and the state and local level to be involved. And I think Gerard is also answering that. So it's also an excellent strategy to be both connected with our efforts at the federal level and to also meet other advocates in your local area and be involved at the state and local level. Okay, I think hopefully we've answered. Oops. What can we as regional champions do to help ensure students with disabilities get the education? Yeah, it's an excellent question too, Kat, around another issue. We'll be monitoring a lot of potential proposals. John, I don't know if you want to talk a little bit about how it works for big changes to appropriations and to policies that could potentially make huge changes to departments?
Sure. Just as a general rule, and this is part of why we focus so much on Congress as a whole, decisions about creating or closing government departments and about funding for those departments are up to Congress. Even though they're administration jobs, they are subject to Congress's decision making. I think there's overall, some, concern about sort of like what will happen to experts within those departments if there is sort of like official proposals to close the departments or these kinds of things, whether Congress actually ends up doing that or not. But I think, in keeping engaged here, we can make sure that we are aware in particular of like different education related issues that affect the disability community and the paralysis community. But again, I think these big things are one thing to propose on the campaign trail, and they are a different thing to actually enact. It's not saying that it can't happen, but it does involve more than just the stroke of a pen to do something like eliminate the Department of Education, for example. So I think splitting that advocacy and making sure that you're staying engaged with Congress as well is a big part of the process.
Thank you, John. And I would also add too that many of the coalitions we're a part of are also tracking these issues. So again, we'll do our best to keep all of our advocates updated of opportunities to weigh in on some of these issues that we have not been normally directly involved in the past. So thank you. These are excellent questions, and we're so appreciative of your attention and time and your efforts to be connected to the foundation and advancing our priorities. So I want to thank all of you. I want to thank all the panelists. And I want to encourage everyone to reach out to Gerard if you don't already know him. So thank you so much, and we'll be in touch soon.